So I'm here today with Dr. Patricia Ogilvie, who's a dermatologist all the way from Germany. We're going to have a bit of a chat about other benefits to you when you're having botulinum toxin as an injectable. So thank you so much for taking the time today.
Thank you very much for having me.
Now I know you did a talk yesterday on other benefits of botulinum toxin, because we all think that you just have your toxin injected and it's going to, relax the muscles, but there's a whole lot more to it that people don't even know about.
Yeah, I call it beyond lines and wrinkles. Yeah, so we do see, and the longer we travel with our patients, this journey of toxin injections, and I'm injecting since more than 20 years, we do see and observe additional changes on their skin. And there is now scientific evidence that somehow underlines that changes. We do, for example, see that there is an increase of the elastic and mechanical properties of skin that makes the skin more resistant to mechanical stress after botulinum toxin injections. And very interesting, done majorly by colleagues from Korea, the toxin has an influence on the production of sebum. So we do know that sebum production, the oiliness on the surface of the skin that looks disturbing, is also feeding the bacteria that are responsible for acne and imperfections. And visibility, of course, if you measure the production of sebum in these cultivated cells, you can actually decrease that by botulinum toxin, and that's what we do see. We see a decrease in visibility, of course, and a decrease of oiliness on the surface in the areas that have been treated.
So that's probably why when you watch ladies on TV, like in Real Housewives or whatever, they've got that, like their skin is not only smooth and wrinkle free, but it's got like a bit of a sheen to it, and the skin is just lovely skin.
Definitely. I mean, in these examples, for sure, there is a combinational effect of injectable fillers, which are made from hyaluronic acid, which is the natural substance in our skin that helps binding moisturization and water. So if you are injecting hyaluronic acid, of course, you also increase the moisture content of the skin itself. But on top of that, and in trials where we have only allowed the patients to be injected with botulinum toxin, we can see that also the toxin alone has an effect on the elastic recoil capacity of skin.
And also you mentioned about the calves. Like, what is it about the calves? Like, I know people get them injected.
Calf slimming sounds strange because you think the calf is a muscle that we need to walk. Actually, in many of our patients, it is a little bit hypertrophic, and these are the ones that are complaining about it because it makes the leg overall look a little bit shorter and a bit more heavy. And if you inject the calves, and I've learned that from Asian colleagues, I have to say, in the proper way, it takes quite some doses initially. We do see that the volume of the muscle comes back to normal and the calf is slimmer, and interestingly, after a successful initial treatment, the slimming effect seems to last enormously long, almost equal to the effect that we do see on the jawline when we are injecting the messenger muscle.
Right, so if you wanted to reduce your jawline, you could actually have the toxin injected there properly, done by a proper practitioner who knows what they're doing and has done a lot of it, but that can help to slim the jawline as well.
Definitely, the jawline, and also the transition from the jawline into the neck by injecting the platysma bands gives you what we call a Nefertiti contour, because we do know, together with the forces of gravity, the muscle of the platysma is pulling all these soft tissue compartments of the face down, and if we are relaxing that, we are decreasing that forces. We still have the force of gravity, of course, inevitable, but if we are decreasing these muscle forces, we get a relatively stronger elevator effect, and that helps recontour the jawline and slim the jawline by injecting the
That makes so much sense. I'll just cover up my neck here, and thank you so much for that.
Thank you very much.
Lovely.
Thanks for
so if you're looking to have a treatment like this done and you're looking for a practitioner, just drop us an email at help@plasticsurgeryhub.com.au. Thank you so much.
Thank you,
today.
Trish.
Thanks
for having me.